The integumentary system is made up of the skin and supporting structures. The skin is the largest organ of the human body and our first line of defense against invasion. Just as with any other body system, the integumentary system can get infection and disease. As our first line of defense, our skin is actually somewhat more susceptible to disease than our internal organs. However, because of the nature of the skin and its supporting structures, it's common for these issues to be more limited than if the same pathogen were to enter the body. Bacterial infections of the skin, such as bacterial dermatitis, acne, and impetigo, generally use topical treatment, such as antibiotic creams and ointments. For more severe cases, oral antibiotics may be used. It has actually also been found that oral contraceptive medication can be effective in treating acne. Parasitic infections are also much more common with the integumentary system than other body systems. The two most common are lice and scabies. These are treated with pediculicides and scabicides, which are generally topical treatments. These are highly contagious, and patients who are infected should be very clearly educated on how to prevent spreading the infection or reinfecting themselves. Although generally speaking, fungal infections are very rare and very dangerous when found within the body, fungal infections of the integumentary system are actually very common and generally not very serious. However, they can be highly uncomfortable and highly contagious. Examples are tinea infections, such as athlete's foot, jock itch, and ringworm, and yeast infections, such as thrush or pruritic infections. Although there are some oral antifungal medications, they have significant side effects and are generally used for the most severe cases. More commonly, these are treated with topical sprays or creams, or in the case of oral thrush, medicated mouthwash. Viruses are less likely to infect the integumentary system than other body systems, with the primary example of a viral infection in the skin being the herpes virus. The herpes simplex virus type 1 will cause cold sores on the lips and the mouth. The herpes simplex virus type 2 will lead to sores in the genital mucosa and is transmitted sexually. The herpes zoster virus will initially cause what is commonly known as chickenpox, which is a systemic infection with a clear integumentary involvement. Upon subsequent manifestations, it will lead to what we know as shingles. Viruses such as the herpes virus, when infecting the integumentary system, are not cured. Rather, they go latent and will reappear in patients throughout their lives. Patients with active infection, such as open cold sore, should avoid contact with others so as not to spread the infection. There are some antiviral medications, both topical and oral, that can help send the virus back into remission, but they, again, do not cure the virus.